So let me get this straight. You can hear that people are talking, you just can't understand what they're saying? Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm discussing the differences between hearing loss and clarity loss. Almost every single person that I test in clinic reports that they can hear that people are talking to them, they just can't really understand what they're saying. Of course, every single time a patient comes to see me in the clinic, they feel like they can hear fine, but I use a form of speech called clear speech, and the acoustics inside of my treatment room are excellent. This often leads my patients to believe that the reason that they can't understand when people are talking to them is because the other person is mumbling. These perceptions also carry over to other things like television, where my patients will swear up and down that the way that they record audio for TV shows now is worse than what it used to be back in the day. Or that cell phones, which everybody uses today, have worse sound quality compared to landline phones from the past. Of course, if you've ever had your hearing tested, you probably already know that these difficulties are caused by hearing loss, but only usually in particular frequency ranges. But if you're new to the world of hearing loss, you may find it confusing that you can hear people talking to you, you just can't understand what they're saying. And that is what I'm going to explain in this video, and the reason why may actually surprise you. But before I get into it, if you could do me a huge favor and click the like button, it really helps out my channel because it gets these videos in front of a broader audience. And while you're at it, if you have not yet hit that subscribe button with notification bell, go ahead and do that as well, because that ensures that you will never miss one of my newly released videos, and I release a ton of new videos every single week. That being said, it's greatly appreciated, and a huge shout out to Resound for sponsoring today's video, but more on them in a little bit. To understand why most individuals can hear people talking but not understand what they're saying, it's really important to understand how the auditory system works. Sound is a vibration of air particles. These vibrations enter the ear canal and vibrate the eardrum. These vibrations are then sent through the three middle ear bones called ossicles and into the cochlea, which is your hearing organ. Inside of the cochlea, you have fluid and a membrane. Along that membrane, you have what are called outer hair cells and inner hair cells. The outer hair cells are responsible for enhancing the vibration of sound along the membrane, and the inner hair cells are responsible for receiving those enhanced vibrations and converting them to neural impulses, which are then sent up the auditory nerve to the brain so you can hear. The membrane inside of the cochlea is like a piano keyboard, with each area being responsible for a different pitch or frequency of sound. The membrane near the entrance of the cochlea is coded for higher frequency sounds, starting at around 20,000 Hertz, and as the membrane travels deeper into the cochlea, it is coded for lower frequency sounds, ending at around 20 Hertz. When most people develop a hearing loss, it is due to the deterioration of these inner and outer hair cells, which prevents the transmission of these neural impulses from the cochlea up to the brain. When you're getting your hearing tested, we are actually measuring this deterioration. And different types of hearing loss will cause damage to different areas of these hair cells along the membrane inside of the cochlea. For instance, with age-related hearing loss, the hair cells in the high-frequency ranges are the ones that tend to deteriorate, while the hair cells in the lower frequency ranges tend to be okay. Noise-induced hearing loss due to overexposure of loud noises typically damages the hair cells between 3,000 and 4,000 Hertz due to your ear canal resonance. Genetic hearing losses typically impact everything from the low frequency ranges all the way up through the high frequency ranges. And different cardiovascular conditions typically negatively impact the low frequency ranges of your hearing. Let's take a closer look at an audiogram of age-related hearing loss, which is the most common form of hearing loss. Remember, the blue X's are the left ear and the red circles are the right ear, and the further down the graph you go, the worse your hearing is. Age-related hearing losses usually result in normal hearing in the low frequency ranges, with a gradual or steep decline in the hearing thresholds through the mid-frequencies into the high frequencies. We could also plot the different speech sounds called phonemes on this graph. The phonemes on the left-hand side of the graph are the vowel sounds, which give the perception of volume in speech, and the right-hand side of the graph has the consonant sounds, which give the perception of clarity in speech. Any of these speech sounds in the white region, below the X's and the O's, can still be heard without difficulty. However, any of these speech sounds in the shaded gray region, above the X's and the O's, can no longer be heard with this type of a hearing loss. And since these high-frequency consonant sounds are responsible for the perception of clarity, This configuration of hearing loss would result in the ability to hear the volume components of speech well, but not the clarity components of speech. And this is how certain types of hearing loss can cause the perception that you can hear someone talking to you, you just have no idea what they're saying. Fortunately, this issue of clarity loss is exactly what hearing aids like the Resound Nexia from Resound, today's video sponsor, are designed to correct for. By providing amplification in the specific frequency ranges of your hearing loss, the Resound Nexia hearing aids can restore audibility of these missing phonemes. This ensures that speech doesn't just get louder, it gets more clear. But the Resound Nexia also goes further than just ensuring that these missing phonemes of speech are audible again. It also automatically adapts to the sounds around you, helping you hear more clearly in all situations, ranging from quiet to really noisy. The Nexia also does this while ensuring that you feel like you're hearing sounds the way you were intended to hear them, with surround sound experience that allow you to stay aware of the sounds coming from all directions. They also offer a personalized speaker system, including Marie, that can help you hear sounds more clearly and naturally by placing a microphone inside of your ear canal. But hearing more clearly isn't the only thing that these hearing aids can do. The Resound Nexia hearing aids are also the smallest rechargeable receiver in the ear hearing aids that you can get. But perhaps the thing that I am most excited about is that these hearing aids use Bluetooth LE audio to stream audio directly into both of your ears at a higher sound quality than any of the older forms of Bluetooth. Not only does this make streamed audio from your phone, tablet, or computer more clear, but it also allows you to stream audio directly from your TV. By using Auracast broadcast audio made possible by Bluetooth LE audio, your TV Streamer Plus from Resound can connect up to your TV and stream that audio from your TV directly into your ears so it is crystal clear. So if clarity in virtually all situations is what you're looking for, then you need to ask your hearing care professional about the Resound Nexia hearing aids. However, when it comes to clarity, there is one other thing that needs to be considered, and that is your word recognition score. During your hearing evaluation, your hearing care professional will perform a speech test that will require you to repeat back one-syllable words without any visual cues and without any context. These scores will be in percentages for the amount of words you are able to hear accurately. The higher these percentages are, the more clear speech will be for you with properly programmed hearing aids. And the only way to ensure that your hearing aids are programmed correctly to your hearing loss prescription is to have real ear measurement performed during your hearing aid fitting. Real ear measurement is essentially a verification technique that is used by your hearing care professional, so when they're programming the amplification levels of your hearing aids, they can ensure that your hearing aids are matching your prescription, so all of the missing phonemes are able to make it back to your brain so you can hear them. This way you can prevent just making all sounds louder, and you can pinpoint the ranges of your hearing loss to make sounds clearer. So to recap, if you want to focus on not just hearing, but actually hearing clearly, then you need to focus on three main things. Number one, you need to understand your hearing loss and focus on amplifying these high-frequency speech components so you can actually get the clarity components of speech back. Number two, you need to ensure that you have a hearing aid that is capable of precisely amplifying the sounds that you need, like the Resound Nexia hearing aids. And three, you need to make sure that your hearing care professional is using real ear measurement to verify the programming of your hearing aids to ensure that you receive the maximum amount of clarity. If you get all three of these right, I promise you that you will be able to hear as clearly as you possibly can.